Hello, everyone, and welcome to today's webinar, Virtual Fertility 101. This is our first webinar of 2021. My name is Maren Gelfond, and I'm a member of our marketing team, and I'll be your moderator. I'm so excited to be a part of this session today. I'm pleased to introduce today's speakers. We have Dr. Juan Alvarez, our lovely host and reproductive endocrinologist, here with us. We have Betsy Bale, a fertility nurse practitioner. We have Brenna Boyd, our andrology lab manager. We have Jürgen Lieberman, our IVF lab director, a video featuring Susan Rosado, who is a member of our behavioral health team, Rose Gallucci, our senior revenue cycle manager, and Tammy Quinn, founder of Pulling Down the Moon, a holistic care center that specializes in fertility, pregnancy, and family health. Before I hand the mic over to Dr. Alvarez, I have a few housekeeping items to cover about this webinar. It will be available on YouTube after the live session. Next, we'd love to hear from you during today's presentation. If you have a question for our speaker, feel free to use the chat feature at the bottom. We'll be answering questions at the end. Please submit these questions privately and open-ended. If you have a specific question that pertains to only your circumstances, we will not answer that question and highly suggest you call us at 877-324-4483 or visit us online to schedule a consultation. Also, please keep your video off and remain muted. Last, we'd like you to share today's webinar on our social networks. You can tag us at Fertility Centers of Illinois and use the hashtag Virtual Fertility 101. So without any further ado, I'd like to kick things off by welcoming our physician, Dr. Juan Alvarez. Over to you.
All right. Thank you. All right, so we're starting the presentation. Hi, welcome everybody. My name is Dr. Juan Alvarez. I am a board-certified reproductive endocrinologist and infertility specialist here at FCI. Sorry, I don't see myself on this thing now. Okay. Anyway, today I'm going to be talking, the reason why we're joining today is because we wanted to discuss what a virtual fertility appointment would look like. You know, given the pandemic, we have moved from in-office visits to Zoom consults. And so we wanted to make it a little bit less daunting to start the process by showing you guys pretty much what to expect throughout the process while you come to see us at FCI. Next slide. First, I want to start off with who we are. Next slide. So Fertility Centers of Illinois, we've been in the Chicagoland area for over 30 years. We've had a lot of experience, a lot of firsts, like the first IVF baby in the Midwest, and also the first ICSI procedure that was done in the Midwest. And ICSI procedure is something that I will talk about later, is a way of fertilizing eggs. And so now we're hitting 2020, and our milestone now is that we are doing virtual visits. Next slide. So we have 8 Chicagoland locations. Currently, we have 5 locations that are open. Our other locations are temporarily closed. So we have our Chicago, Glenview, Hinsdale, Hoffman Estates, and Tinley Park offices. But all of our physicians are seeing patients in these offices as well for procedures, as well as seeing patients virtually. Next slide. And so I'm very honored and very proud to be in a group of these lovely physicians. We're a group of 12 doctors that we all share our offices. We both have 2 different offices that we go to. Next slide. So who comes to us? Who's going to come to FCI, and why would you come to see us? First of all, we have a lot of different patients who do come to see us. We have heterosexual couples that are trying to conceive, usually women who are less than 35, who've been trying for more than 12 months. They come for an evaluation. Women who are greater than 35 years of age, they come in after 6 months of trying to conceive. But also anybody who has any reason that they can believe that they have some problems conceiving or irregular cycles. Things like that, definitely you should come to see us for an evaluation. We also see same-sex couples, single parents as well, transgender patients and couples, We also do fertility preservation for both social reasons as well as for cancer patients. And we also have a huge third-party group where we have our own egg donor cycles. Next slide. So how does it all start? First of all, it starts with calling our new patient call center. Phone number is on the screen. You can also find this online, fcionline.com, and you can fill out a form and set up your appointment. Once you talk with our specialists in the new patient call center, they're going to be providing you with your appointment date as well as getting your insurance information. You're going to be receiving a welcome letter. We're going to be verifying your insurance. So we have everything sort of in line for your first visit. Next slide. And what will that first visit look like? Well, it will be virtual, just like we're doing right now. Where you get to talk with one of our lovely physicians about what brings you to see us. So this is the opportunity for us as a doctor, for me as a doctor, to really listen to what's been going on. We're going to get history, cycle length, how long have you been trying, what have you been doing at home, any testing that has been done by your gynecologist, as well as medical conditions, surgical conditions. Sorry, that's my dog. As well as any family history. This is the opportunity, the best time to address any concerns that you may have, as well as just talking about just general fertility. Next slide. So during the first visit, we are going to be doing some testing. So this is sort of a guide of what a normal fertility evaluation would look like, but it also depends on your specific situation. But I'm only going to talk about just overall what we're going to do. First thing we want to do is always look at ovarian reserve testing. And the reason for that is because women are born with a set number of eggs, and then throughout your reproductive years, your egg count starts to go down. And so we want to know how many eggs you have. And so we do that with pelvic ultrasound and some hormone testing. Next slide. So the transvaginal ultrasound is to look at your ovaries. And inside of the ovaries, you're going to see these little black circles that you see on the screen. Those little black circles are a follicle, and each follicle contains an egg. And so we count the number of follicles in each of the ovaries, and that correlates with your egg count. The more follicles that we see, the more eggs that you have. Next slide. Other tests that we would do at the beginning of your cycle, one of them is called the AMH level, the anti-Mullerian hormone. So this hormone is very specific in determining your egg count. The reason for that is because AMH is secreted by the cells that surround your eggs. So the more eggs that you have, the higher your AMH level will be in your blood. So that's a good marker. Next slide. But not only do we get the AMH hormone, we also get a whole slew of different hormones. And this is just a representation of what the menstrual cycle will look like. And you can see how different hormones fluctuate throughout the menstrual cycle. And so we get our patients to come in on day 3 of their cycle, where we know that their hormones would be right at baseline. And so this gives us more information about your fertility. Next slide. Nope, previous slide. Yes. All right. The next component of the evaluation, once we've done the ovarian reserve testing, then is to evaluate the pelvic anatomy. We want to look at the uterus, we want to look at the fallopian tubes, we want to make sure that there's any pathology, if there is any pathology, so that we can deal with that. Next slide. There's different ways of evaluating the uterus and the fallopian tubes, and your doctor will recommend one of them. One of them is called an SIS, or a saline instilled sonogram. This is where we put saline water inside of the uterus, and then we do a 3-dimensional ultrasound, and we can look at all the structures inside of the uterus as well as the fallopian tubes. The other test is called an HSG, hysterosalpingogram. So this is an X-ray. So instead of using saline water, we use a contrast solution, and then we get to see the uterus and the fallopian tubes on the X-ray to see if there's anything that's abnormal. Next slide. And last, but definitely not least, We are looking for any male factor problems. So we would also get a semen analysis on the male partner in order to look at sperm concentration. We want to look at sperm motility. We want to know how many of the sperm look normal. And these three components will generally be the fertility evaluation. Now, there's going to be several other tests, of course, that your doctor is going to be recommending, and that's something that we talk about in the first appointment. Depending on your specific needs, we discuss everything from what could be happening, what tests we're going to be running, and then we're actually going to be doing the testing. One other thing that you should remember always in our office is that everything that we do starts with the menstrual cycle. So everything that we do starts with the period. So don't be alarmed every time we talk to you guys. It's always going to be, what was the first year or the last menstrual period? Because all of these tests have to be done in a specific time in the menstrual cycle. Next slide. So then after we are done discussing your medical history, as well as discussing what workup we're going to be doing, the next step after talking with me would be to meet with your nurse to go over all those tests, to plan ahead and see when you're going to come into the office to do all those tests. Then after that, after we do all the testing, then you will follow up with me, with your doctor. And it usually takes about 4 to 6 weeks to complete the evaluation. Next slide. So now I'm going to introduce Betsy Bale. She's our wonderful nurse practitioner. She's going to talk to you guys about what to expect after you talk with the doctor.
Thanks, Dr. Alvarez. So hi, everyone. My name is Betsy. I am the nurse practitioner at Fertility Centers of Illinois. I've been here for 6 years. The first 4 years, I was the nurse practitioner, or the first 4 years I was the nurse, and then the last 2 years I've been the nurse practitioner. And the reason that I continue to work at Fertility Centers of Illinois is for the relationship that I'm able to build with my patients. So I'm able to celebrate those really high and exciting moments, and then also be there to support them through those really difficult and challenging ones and everything that's in between, which is something that's very special, and it's a bond that is really, really cherished at our center. At Fertility Centers of Illinois, a lot of the communication is going to be with your nursing team. Each physician has a set of nurses that they work very closely with. So other than a procedure which may be done by another physician or a couple of conversations that may be done with other nurses, most of your care will be taken care of by your specific nursing and physician team to increase that continuity of care. The nursing team will also be the ones that will connect you with the other departments and members of your team. So they're the ones that are going to go ahead and talk to your, let the financial team know what type of treatment you and your physician have decided to do so that they can run that through your insurance. They'll let you know when the financial team gets that approval so that you're able to start treatment. And then the nursing team will also be the ones that will help you get all of your questions answered from the other departments in our center. So our embryology team, our andrology team, our ultrasound and phlebotomy teams, along with our third-party team, which is a set of nurses that work specifically with patients who are working with gestational carriers, egg donors, and known sperm donors as well. The nurses will also be the ones that will kind of break down each step of the cycle process with you. So after you meet with your physician, as Dr. Alvarez says, they give you a whole list of things to do. So the nurses are the ones that will help you time that out. They'll go through the logistics with you about when each appointment is needed to be made, what types of appointments they'll entail, and what testing you'll have done at each appointment. Along with, once you've decided on the form of treatment that you're doing, they'll be the ones that will help you order your medications through your specialty pharmacies. They'll go through the consents with you that you're going to need before your treatment plan. And then they'll remind you of all the items that are needed before you can take your next steps in your care. In addition to this, each time you come into Fertility Centers of Illinois for monitoring or any form of treatment, your nurses will be the one that will check up on you and remind you of your next steps later on that day. So they'll be the ones that will go through the results that the physician has reviewed and then talk to you about the recommendations in your next step based on those results of that day as well. Your nurses are also going to help you teach you about your process and your journey and give you the resources that you need so that you can succeed. So as I said before, they'll break down the logistics of each treatment plan that you go through. They'll instruct you and educate you on how to use some of those medications. We do have you take some injectable medications at home at times, depending on the type of care that you're given. So they'll go through how to inject them, how to mix them, all of that good information that you'll need. In addition to that, they also will be the ones that will provide you with resources for your treatment. So we have on our website, we have lots of information about different diagnoses that are related to fertility treatment, along with questions that patients may ask, so answers there, helpful handouts that can help you cope with treatment, along with support groups that we have that you can register for as well. We know that this process is not only physically challenging at times, but can also be emotionally tolling as well. So we can get you in touch with our on-staff psychology team to schedule a Zoom consult right now to talk about the emotional aspects of care, and then also get you in touch with other resources such as Pulling Down the Moon to help complement the care that you're getting to help create a successful journey for you. We are also there to answer any questions that you have. We know that the website is filled with lots of myths and different things about treatment, so we're the ones that you can always ask about confusions that you may have so that we can make the myths, we can decipher them versus the reality of treatment as well. We have telephone calls and portal messages that you'll hear from your nurses after you ask within 48 hours. So all of your questions regarding your process can be answered. Overall, our goals are your goals. We want you to succeed, and we are going to be your advocates. Like I said, the best parts of our jobs are celebrating those highs, but we are also there to get you through those really challenging times as well. We are there to answer your questions, support you through your journey, and overall, try to get you through something that can be difficult and rewarding at the same time. With that being said, I do have a couple of tips to help you get through your journey. First, be kind to yourself and try to remove those stressors from your life. Going through treatment can be challenging at times, so it's not the best time to start a brand new project, move, go ahead and change jobs, but rather is a time to rest, comfort, and pamper yourself and eat those favorite foods that you love to eat. In addition to that, trying to limit your travel as much as possible and mandatory events outside of treatment. So as you go through your treatment cycle, there's a lot of different appointments that are needed that are on a day-by-day basis. All of our monitoring depends on how we move forward with your treatment depends on how your body responds to the medications that you take. So removing those stressors helps to improve the chances of your cycle and helping monitor those aspects of your care as well. And then finally, ask questions. That is what we are here for. We know that this process can be extremely overwhelming at times, so anything that you need, that's what our nursing team is here for. We want to help you get through this journey with the ultimate goal to succeed. With that, I am now going to pass you over to Brenna, who is going to talk about our andrology department. Thank you so much.
Hi, everyone. My name is Brenna Boyd. I am the Andrology Lab Supervisor for Fertility Centers of Illinois. I have been with the company for 3.5 years. I started out in graduate school studying male factor infertility, and it led me to choose this amazing career path. So, next slide, please. So with andrology, it's the study of the male reproductive system. So we are the laboratory that really focuses in on evaluating semen samples. We currently have 3 of our offices offering andrology services, Glenview and Hinsdale, Monday through Friday, and we are open in River North 7 days a week. We really hope to have all of our facilities up and running soon. So the andrology services that we offer here at Fertility Centers of Illinois are semen analysis, which is a standard part of the male workup where we analyze semen samples for count, motility, and morphology. We'll talk more about that on the next slide. Intrauterine insemination, which is where we wash and prepare a semen sample, either fresh or frozen, for insertion through the cervix and directly into the uterine cavity for insemination. And we do this with partner, known donor, and anonymous donor samples. And we can also freeze samples for later use in treatment with IUI or IVF. Next slide, please. So with a semen analysis, we look at 3 main components. We're going to look at the sperm count, how many are there, sperm morphology, whether or not they look normal, and then sperm motility, which analyzes the percentage of sperm moving in a sample. The below picture here is an example of a morphology analysis. We have a computer-assisted program that allows us to better help visualize sperm under intense microscopy. The box on the right details some of the parameters we use in analyzing a sperm sample, but I won't bore you by going through all of them. Next slide, please. So this is an actual example of a sample washed and processed for IUI here at Fertility Centers of Illinois. The sample was prepared for IUI, so as you can see, the sample is clean. The sperm are able to swim rapidly and with great forward progression, which is what we need to get to the egg. Next slide, please. So when it comes to collecting samples, we always like to make new patients aware that we recommend that you abstain from ejaculation for 2 to 5 days. Samples are produced via masturbation into a sterile cup, and collection kits with sterile sample collection cups are available at any of our FCI locations. These samples should be collected no more than 2 hours before your scheduled appointment time and kept close to the body during transport. And due to the COVID-19 pandemic, all samples currently must be produced off-site and brought into the laboratory at your scheduled appointment time. So once we've completed your analysis, next slide, we provide that information to your physician, and they will help make recommendations for treatment and any supplements you may need to take to help keep your sperm super. With that being said, I'm gonna pass it over to Dr. Alvarez again, and thank you guys so much.
Hello. All right, next slide. All righty, so what happens after you guys go through the entire evaluation? We've done the ovarian reserve testing, we've done the uterus and tube analysis, we've done the semen analysis, as well as other lab work that will be done throughout the process. And so we are going to need a second time to review the results, to review what the results mean, and to discuss treatment plans. Next slide. So there are, depending on the diagnoses, there are several different treatment options that we will discuss in our second appointment. Now, there are ways to do ovarian stimulation. So in a natural cycle or a normal ovulatory cycle, women ovulate 1 egg, and that's the only chance that month for pregnancy. And so what we do for ovarian stimulation is we provide fertility drugs, fertility medications, to stimulate the ovaries to produce 2 or 3 or 4 eggs, so that we can increase the odds of pregnancy. So that's one way of treating. Next slide. Another treatment option, which Brenna already spoke to, is called an intrauterine insemination. You will hear this as an IUI, or just simply as an insemination. Some people say artificial inseminations. But basically, we can combine either ovarian stimulation or a natural cycle. And then at the time of ovulation, we would prep the semen sample, wash all the dead, not moving sperm. Like Brenna showed, we want all those fast moving sperm to be in the sample. And so as the physician, what we do at the time of ovulation, we concentrate the sperm in a small catheter, and then we insert the catheter right through the cervix into the uterus, and we deposit the sperm right inside of the uterine cavity, putting the sperm as close to the egg as possible. Now, these treatment options depend on the diagnosis, of course. Next slide. And of course, we have IVF, in vitro fertilization. So with IVF, we're really taking control of the whole process. We're doing an ovarian stimulation. So here you see how in the beginning of a cycle, all your follicles are going to be nice and small. Okay, that is what we want. So when we stimulate the ovaries, when you give yourself hormone injections, they're going to stimulate all of these follicles to grow. So they're going to be growing over time, and that's what we want. We want the majority of these follicles to grow so that we can retrieve a mature egg. Next slide. So once we do the ovarian stimulation and we know that we have a maximum number of eggs that we're going to be retrieving, then comes the egg retrieval process. And that is done with sedation. It's done under anesthesia through ultrasound guidance. Here you can see that we have an ultrasound probe. There's a needle guide. We go right into the ovary while you're asleep, so you won't feel any pain and you won't remember any of this procedure, but we go inside of the ovary, we go into one of those follicles, and we're taking out the eggs out of the ovary. Next slide. So once the eggs are outside of the ovary, then we will fertilize them. And there's two ways of fertilizing them. There's a conventional way and there's an ICSI way, like I said in the beginning of the presentation. And Dr. Lieberman is going to be discussing this a little bit further, but these are the two ways of fertilizing the egg, which is discussed during our second appointment. Next slide. Once the egg is fertilized, we watch the embryos grow over time. We want to make sure that they're dividing properly, and they end up on the blastocyst stage, which is the last stage prior to implantation. Okay, so in the laboratory, we're able to see your eggs fertilize, the embryos grow, and we're able to grow them all the way to the very end, right prior to implantation. And then next slide. And so once we have that day 5 beautiful looking embryo, there's several different things we can do. We can either freeze the embryo, we can do a biopsy on the embryo and do genetic testing, or we can do a fresh embryo transfer, which is shown here. This is what an embryo transfer looks like. So a fresh embryo transfer is done 5 days after your egg retrieval. So day 5 of embryo development, we'll get the best looking embryo. Again, like the IUI, it's going to be placed in a little catheter. Catheter is put right into the uterus, and we're putting the embryo right in the middle of the cavity so that it can hatch and implant. Next slide. So now that I discussed a little bit about all the treatment options that we have here at FCI, Dr. Lieberman, he's our lab director, embryologist, who's going to be talking in a little bit more detail than I did about what goes on in the IVF lab.
Thank you very much, Dr. Alvarez. I don't see myself, but it's okay. Here we go. Thanks for joining our meeting, virtual meeting. And I want to give you a very short overview about what we're doing in an IVF lab. I'm doing IVF since 1995, and I was appointed to be the lab director of the IVF lab, the andrology and the endocrinology at FCI since 2004. I have a staff of 10 embryologists, all highly trained. And next slide, please. I just want to show you a little bit the key procedures we would perform when you would come to us. As Brenner already mentioned, we have to get the sperm, we have to prepare the sperm, we will retrieve the oocyte, when we will use two different techniques we can provide. Fertilize the oocytes. We then culture after fertilization the embryos to day 5. We will perform an embryo transfer, and remaining embryos we can cryopreserve and can offer for later use in case you didn't get pregnant with the transfer of a fresh embryo. And many couples also decide not to do a fresh transfer. In that case, they want to get their embryos genetically tested. That means we have to perform an embryo biopsy, remove some cells on day 5, day 6, or day 7. And then after the biopsy, we freeze the embryos, we wait for the results, and then we can determine which of the biopsied embryos are normal and eligible for transfer. Next slide, please. When we talk about embryology and training and the skill and proficiency, it's really a long path. I can tell you, with us, it takes about 5 years to be considered as a senior embryologist. In these 5 years, you can level up from an embryologist in training to a junior, an embryologist, and finally a senior. And we do competency and proficiency testing every year. We are, as a lab, accredited by the American College of Pathologists. This accreditation happens every 2nd year, and I myself am CAP inspector inspecting IVF labs in the United States. Next slide, please. This is a short sequence of an ICSI, and ICSI, you know, it stays for cytoplasmic sperm injection. It means you see on the right a glass needle containing a sperm. When you focus on the tip of the needle, we go inside the oocyte with this needle. We aspirate some cytoplasm. That happens here. Sperm goes a little bit backwards because we aspirate. And when we break the lemma of the oocyte, and when we release the sperm inside the oocyte and remove carefully the needle. Here we go. We then know about 16 to 18 hours next day, about in the morning. So we know about after 16 to 18 hours if this oocyte was successfully fertilized. Next slide, please. So this is a very interesting video. It is a time lapse from an embryo. We can here culture in a special incubator, and it will summarize in about 90 seconds, 5 days of the culture of a human embryo. It starts with fertilization, 2-cell embryo, 4-cell embryo. Everything you see here, we call it blastomere. It goes to an 8-cell embryo. With blastomere starting to fuse like it happens here, and when you get a blastocyst here, how it looks on day 5, about 120 cells of ectoderm cells. And when you focus on the 7 p.m. position, you see here the inner cell mass called ICM, which is actually the fetus. And when we talk about an embryo biopsy, because a couple is seeking genetic information on the embryo, we then make an opening in this blastocyst and remove a couple of ectoderm cells. These are the cells you see in one cell line outside surrounding the embryo. Next slide, please. As I mentioned before, because of the way how you will be stimulated, you will have more follicles and more oocytes. We will retrieve from you, also fertilize. Finally, we'll have more embryos in culture we will transfer into your uterus. So we can cryopreserve these remaining embryos for later use. And we have a special technique to cryopreserve them at very low temperature. When we thaw these embryos, they have literally the same potential to achieve pregnancies like fresh embryos. Next slide, please. Our target here is for every patient comes to us to achieve a pregnancy with a positive outcome, but we focus especially on the delivery of a single healthy baby. We try as much we can to prevent multiples. Next slide, please. Thank you very much for your attention, and when we have Q&A later, I'm happy to answer any questions you might have. Thank you.
All right, so next we're going to be talking about our support system here at FCI. We're going to listen to a video from our behavioral health specialist, and then our financial coordinator, as well as holistic medicine specialist, will be joining us. Next slide.
Social worker, and my motivation to come to FCI and work here, as Dr. Hubeka was sharing his pride in our lab, in the team, is I was able to create my family here and have my children here. So it's definitely a practice many years ago, but a practice I truly believe in. So our mission is to support our patients by providing accessible care to help reduce the emotional stress that comes along with fertility treatment. And our objectives include working together with our clinical teams, our FCI staff, to support the most comprehensive and multidisciplinary approach to patient care. So we're very proud that we have all of our supportive partners through this care. Patients can refer themselves to see us, a physician or nurse can refer them, and we also see our patients with this fancy term, collaborative reproduction referral, and that would mean any patients working with any type of third-party arrangement, donor sperm, donor egg, or using a surrogate carrier. Next slide. So here are our members of our team. Dr. Edwards, Tiffany Edwards is our full-time psychologist, and I am here a couple days a week and Saturdays. And we are multiple in-person locations in a regular time that isn't COVID. We are in the River North office, most commonly Hinsdale, every other week, in Buffalo Grove once a week. Right now, we are doing all of our consults by Zoom. We don't need to touch you or do an ultrasound, and so this kind of seems like a safe option. And many of our patients are very appreciative of that because they could be somewhere and Zoom with us, and so not always having to drive in for an appointment. We can see patients Monday through Saturdays. Next slide. So like I kind of indicated, and as many of you can imagine in considering treatment or being in treatment, that there may be many questions. There's a lot of uncertainty through this process. There may be decisions to be made. There's many questions that patients have concern about medications that they bring to the team and how to, they're concerned for side effects and how this is going to emotionally make them feel. There may be great disappointment, and as Allison indicated, we're here to help support you through those disappointments and those challenges. There may be frustration. There may be issues with communicating to those in your support system, colleagues, partners, family. So kind of talking about some communication strategies with this, it can be very overwhelming. And often there can be many other concurrent life stressors going on. Next slide. So we can offer, what we do offer at FCI is we will provide a complimentary visit to you. And so we really encourage you to use that. Usually about half of our consults include some of those supportive visits, and there might be people kind of struggling through treatment, kind of figuring out what to do, decision making, and we're here to companion with you through that time. We also can offer another complimentary visit. That means these won't be billed to your insurance when patients are planning an IVF. We will bill for our services when somebody is going to see us ongoing for treatment. We can also help with referrals out in the community, or if somebody is seeing us from one of those third-party consultations and we're talking a little bit about working with donor sperm or donor egg. Next slide. So in the consultations, we may talk about some decision making. As Dr. Hobeika referred to, we want to hear your journey, what you've gone through, and how this story is about you, and what are your goals and hopes. We want to hear your motivation. We might talk about long-term and short-term implications, what you might plan on sharing with others and this child. A lot of times we're focusing on communication. That's a big issue, and we want you to stay close and continue that good communication with each other through this process if you are proceeding with a partner through this. We might want to talk about the timing and planning and hopes. We may talk about how to communicate, like we talked about, that best support for each other, how to talk to family and friends is a big one that comes up in a lot of kind of coping and strategizing, how to deal with those, the treatment stressors and outcomes or proposed outcomes. Next slide. And then if we meet with you for a third-party evaluation, that fancy term that if we might be, this might be a single person working with donor egg or donor sperm, or a couple working with one of these options or both, or choosing a gestational carrier. The American Society of Reproductive Medicine that we work under the umbrella recommends you meet with us, and we kind of have a psychoeducational session about this. And so we will do that, and we may talk about how you might choose who you might be working with as a donor candidate or a surrogate carrier. We might talk about this process. We definitely want to know what you understand about this process. If you were working together as a couple, we want to make sure you're together in this decision. And then we're going to talk about more future oriented with what might you share with this intended child, what might you share with your family and friends, and talk about some resources, websites, and support networks. We also are consulted when FCI patients are considering donating their extra embryos, additional embryos when they are done with having their family and talking about what's involved with that. Next slide. And finally, we have some support group options in the community. These groups are open to all patients. You don't have to be an FCI patient. Some of our patients become FCI patients because they've come to our groups. And our groups are very dynamic in non-COVID times. They meet in person and they love to connect with each other. And now we are meeting on a Zoom platform. And they're kind of doing that as well as the best that they can. People really appreciate that time to connect with others, especially in this more lonely COVID time when they kind of feel like they're going through this on their own. So we offer a group for women who are going through this journey or thinking about going through this journey on their own, for couples and support people, a regular infertility group. Those are both monthly, and then quarterly we offer our recurrent pregnancy loss group, Together We Begin Again. These are no charge. We just ask that you sign up and through the Eventbrite, and you'll be provided that Zoom link.
Hello, everyone. My name is Rose Gallucci. I'm the Revenue Cycle Senior Manager, and I've been with FCI for almost 2 years now. So during your services here at FCI, a financial coordinator will be assigned to you. The financial coordinator will provide you with insurance coverage information, which is your specific plan coverage, and inform you of any out-of-pocket that you may be responsible for. If you do not have insurance coverage, the financial coordinator will also provide you with the payment options, including our loan credit options that we have. So one of the things that we hear a lot about is mandated states. So Illinois is one of them. And what does that mean? That Illinois law requires insurance companies to provide coverage for infertility to employee groups of more than 25. The law does not apply to individual policies or smaller employer groups where the employer has fewer than 25, or if a policy is actually written outside of Illinois. And not all employees in Illinois may have insurance. It also depends where the plan is written. Infertility coverage may include different types of coverage. So some plans that cover all treatment options, and that's great. But there are plans that have what we call diagnostic testing only. They may have diagnostic testing and treatment. There's also plans that have a dollar limit, which you may be referred to as your calendar year, or there are plans that have a lifetime max. And then there's plans that also refer to a lifetime max that is separate service, and then another lifetime max specific to your pharmacy. So there are different plans out there, and your financial coordinator will help you understand what your plan covers. The other items that, or I should say the lingo that we use here in Revenue Cycle is your copay and your coinsurance. Your copay is an amount that the patient owes at the time of service, and this is based on the insurance agreement. So most of the times this is right on the front of your insurance card, and it will say a copay for your PCP, your specialist, and that ranges from anywhere from $25 to $50. Then you also may have what we call coinsurance. This is the amount due from the patient after the insurance has paid its portion, which is usually a percentage of the claim. So you may have what they call an 80-20. The insurance pays 80%, and you might be responsible for 20%. There is also a deductible. Every year we start with a new deductible, and that is usually just a set amount. So you may have all three of these to meet, or you may just have one or two of them, depending on what your plan is. Some of the insurance companies also require what we call pre-cert, prior authorization for your services. And this may take up to 15 business days to acquire from the insurance companies, which many of the times, or most of the times, it's out of our hand. We submit the authorizations, and then we have to wait for the insurance companies to get back to us. So next, I introduce to you Tammy Quinn, which is the holistic medicine specialist.
Hi, everybody. My name is Tammy Quinn. I'm a registered yoga teacher. I am the co-founder of Pulling Down the Moon, which has been around for almost 20 years. And probably most relevant for this conversation, I myself am a former fertility patient. Next slide, please. I want to talk to you today a little bit about why it might be important to take an integrative care approach to fertility. We know that fertility can affect all aspects of one's life. And I know personally, when I was going through it, it can affect you physically, it can affect you mentally, financially, your relationships with other people, and even spiritually and existentially as you start to ask a lot of different questions about why this is happening to you. Lifestyle choices and whole health, we've learned, can be very important in helping you increase your success rates. We also know that it can be a very, very lonely journey, and that's why community and support is the secret sauce. We already heard from the video from Susan how important mental health support is. But we also need to realize that it's a natural inclination to go online and find resources and support online. And we want to caution you that while that can sometimes be helpful, oftentimes it can be filled with inaccurate information, mixed messages, and even opportunism. And that's why we want you to know that between Fertility Centers of Illinois and Pulling Down the Moon, there are free, low-cost, trusted resources available for support. Next slide, please. So Pulling Down the Moon, as I mentioned, has been around for almost 2 decades. We are a holistic fertility center and online resource. We are created by women for women, and most of the women who are treating have actually experienced some form of challenge in women's health or fertility themselves. And we are experts in fertility, pregnancy, and postpartum. In fact, about 97% of all the patients we treat are going through infertility. I mentioned that I'm a former fertility patient, as is my business partner, and we are the first full holistic fertility center in the United States. There are online and telehealth options available, and we have multiple locations, including in River North, about half a mile down the road from FCI, and also in Highland Park. Most importantly, we work with your medical doctor. So if you're working with Dr. Alvarez and you have a treatment plan from Dr. Alvarez, you can bring that to us, or we can speak to him on how to integrate holistic medicine. Next slide. And holistic medicine in our purview includes things like acupuncture or traditional Chinese medicine, which can also be great for men and sperm quality issues. We do a yoga for fertility program that is now offered online. And in fact, we have research that we did with FCI that shows our yoga for fertility program decreased anxiety rates in patients by about 20%, which is very significant. We offer fertility enhancing massage, which is a copyrighted program only available through our center that really focuses on massage that is specific to where you are in your cycle. And a very big one, and I'm sure you all have a lot of questions about it, which is nutrition and nutritional supplementation. We know that even a 5% increase or decrease in body weight can affect fertility and reproductive function. There's also more and more emerging research about the benefits of a fertility-friendly diet and potentially the addition of supplements. So you can start by working with Dr. Alvarez or one of the doctors at FCI, and we are always there to help and have additional support for you. The most important thing is that we really focus on services that have been proven to make a difference. So we're based in science and rooted in ancient traditions. So with that, I am going to turn the microphone back over to Dr. Alvarez for your questions. Dr. Alvarez?
All right, thank you, Tammy. Okay, so we are at the end of the presentation. This is the opportunity to ask questions. One thing that I did wanted to stress that it just hit me when Rose was talking about the insurance and how the pre-cert takes 15 days, up to 15 days. So I would highly recommend, if you are wanting to start your evaluation, to do it as soon as you can and not to wait, basically because there's so many different steps that have to be done, as well as insurance. And so things can get delayed. And if we want to start treatment right away, it's something that is definitely that you should consider earlier rather than later. So with that, I open the floor to any questions. You guys can follow us on Instagram, on our Facebook page as well. You can follow myself on Instagram at Dr. Juan Pablo Alvarez. I'm going to be posting some educational things, fertility, and then also Pulling Down the Moon, Instagram and Facebook at Pulling Down the Moon. So we're open for questions.
Okay, so we do have one question right now. So it says, if you have Illinois-based insurance but are not receiving care in Illinois, is fertility treatment still covered? So this would be for Rose.
That's a good question for Rose.
Yes, so you're not receiving treatment in Illinois. That would mean it depends on where you are treating, then they would have to send that in and verify what coverage you have.
Okay. So the next question is it possible to have 2 embryos implanted?
Yes. So for everyone, we are highly recommending to do single embryo transfers. And the reason for that is because over time, IVF has become so successful that before we were transferring 2 or transferring 3 embryos, we were doing day 3 transfers. And so now that we're doing day 5 transfers, our culture system is much better. We can do genetic testing. We are highly recommending everyone to do a single embryo transfer for 1 baby at a time, because that's the healthiest pregnancy for all. Now, depending on specific situations, age, diagnosis, embryo quality, different things, there could be more than 1 that can be transferred. So it's all dependent on your testing.
Great. Do we need to request work with the financing department, or will insurance automatically be verified prior to any treatments? Another one for you, Rose.
Yes, so what happens in our system here is that you would call our call center, make an appointment, and at that point you're given you give your insurance information, and that does come on a list, and we do verify that you have coverage. However, once you do come in for your consultation and you have your treatment plan in order, then you will know what your out-of-pocket and what other needs that you need to be met. But yes, prior to going ahead with your services, we do verify, and we also do get a prior authorization if it is needed for your services.
Great. Okay, what supplements or vitamins do you recommend for male factor low sperm count, morphology, or mobility?
Okay. Well, it all depends on how abnormal it is. If it's highly abnormal, then definitely going to see a urologist for a full workup to see why there is an abnormality in sperm quantity and quality. If it's just mildly abnormal, the best supplements would be a men's multivitamin and taking a daily coenzyme Q10. That has been shown in 2 randomized controlled trials to improve sperm quantity and quality.
How does FCI treat mechanical causes of infertility, like endometriosis, cysts, etc.?
Great question. It all depends on how the endometriosis was diagnosed, of course, or is there any pelvic adhesion pathology? Is it just inflammation? Is it just endometriosis? And so that is something that would have to be more specifically discussed with your doctor, but there's lots of different ways. We know through the literature and through different studies that we can downregulate endometriosis by doing Lupron treatments, and that has been shown to improve pregnancy rates. Depending on implants or depending on symptoms, surgery can be also recommended, and pregnancy rates have been shown to improve after surgical treatment of endometriosis as well. Now for cysts, it all depends on what type of cyst it is. Is it a functional cyst? Is it a solid cyst? Is it a complex cyst? So it all depends on the type of cyst. Majority of cysts are non-functional benign cysts, and they usually go away over time, and so we don't usually treat them or do anything with them. If it's more of an endometrioma cyst or a dermoid cyst, depends on size, location, but it could also be surgically removed.
Going off of
you're muted.
Are there any vitamins or supplements that you recommend for somebody who was diagnosed with PCOS?
Yes. So for PCOS, if you're not trying to conceive, then you don't need the prenatal vitamin. There really isn't anything else that I would recommend as far as for PCOS other than myo-inositol. There's been several studies that have been shown that women with PCOS have a deficiency in myo-inositol, and so that is one of the supplements that I recommend. Other than that, there really isn't any other supplement that can help with the pathophysiology of PCOS.
And Dr. Alvarez, if I could add just about myo-inositol that you recommended, and we are also seeing empirically women come to us who do go on myo-inositol and are having really terrific results with potentially getting cycles back that they haven't had in years, or just regulating some of their hormones. So we also would recommend myo-inositol. Thank you for that.
Great, thanks for joining us. I am in Kentucky. How do they deal with out-of-state patients? How do we deal?
The insurance.
Well, you can,
Sorry.
as in, yeah, I'm not sure, as in, you can always see us, Zoom consult. So we can see you. We can also work with different fertility clinics in Kentucky, but as far as, cycle costs and things like that, I will have Rose answer that.
So if you were to come to FCI, we do still verify your benefits as an out-of-state plan, and then you're given the information of what your financial liability may be.
Great. For Tammy, does Reiki help with fertility, and is it offered at Pulling Down?
I actually am a Reiki master, and I will tell you that in all honesty, there is no evidence suggesting that Reiki can actually enhance outcomes of fertility. However, we do know that Reiki is extremely beneficial in managing stress. And oftentimes when you are stressed, you eat too much, you don't sleep, you fight a lot with your friends and your spouse or your partner. So there are values to something like Reiki, although there is not a direct connection to conception rates.
Okay. What is the likelihood for multiple babies with IUI and IVF?
So the risk of having multiple, so twins, is about 15%, 10 to 15% with IUI, and triplets is about 1%. For IVF, with a single embryo transfer, the chance of having twins is 1%.
Is it recommended to have the COVID-19 vaccine prior to starting IVF treatment?
It is recommended to get the vaccine as soon as you can. So as soon as it is available, please go ahead and take the vaccine. Both ACOG, the American College of OBGYNs, the Society of Maternal Fetal Medicine, who deal with high-risk OB patients, as well as the American Society of Reproductive Medicine, they're all recommending for women in general to get vaccinated. And especially ACOG says that or ASRM says that if you're trying to conceive, you should still get vaccinated, and or if you're pregnant as well.
Excellent. Is there a way to increase the number of eggs or number of follicles per cycle?
So unfortunately, this is where biology hits a hard stop. There isn't a way that we can increase the number of available follicles. Now, there's been some evidence and some studies that taking daily DHEAS can increase slightly the follicle count, and this is working through a pathway with androgens, trying to push your primordial eggs, which is the egg pool, into that antral pool so we can stimulate them. But there isn't anything that is highly proven to increase follicle counts.
Is Pulling Down the Moon services covered by insurance?
So when you come to pulling down the moon, you will pay out of pocket at time of services. However, you will be given a super bill that you can submit to your insurance carrier. And we are seeing, depending upon the insurance that you have, we are seeing some decent reimbursement rates. So we encourage all of our patients to submit them to their insurance carrier. And as time goes on, we're seeing that more and more is becoming covered. So that's encouraging as well.
Talk a little bit about prenatal vitamins. You, Tammy, and Dr. Alvarez.
Go ahead, Dr. Alvarez.
So prenatal vitamin, they need to have at least 400 micrograms of folic acid. And then I also recommend at least 200 milligrams of DHA, which is shown to help with fetal brain development. So that's all I recommend for right now.
And I would just like to add that if you can make sure that it's a high quality vitamin, you want to make sure that it's void of sugars, void of high mercury levels if you're taking something like a fish oil. So please just make sure that you are taking vitamins that are, the source, that they're reviewed, and that they're high quality if possible.
Yeah, Tammy brought up a really good point. Look at the ingredients. Always, and make sure that there's no like fillers or any other things that can get in the way of just the benefit of taking a prenatal vitamin.
I am 42 going on 43 in a same-sex relationship, but wish I could delay pregnancy by a year or so. Can I freeze embryos for later? Is there hope for pregnancy in one's mid-40s?
Yes. So the success of IVF is age dependent. Since you are 42, I would highly recommend to freeze embryos, soon. I would say within the next 3 to 6 months, because we do see a steep decline in fertility starting at age 42. Now that's not for everyone, especially we do see 42-year-old women who get pregnant on their own. And so really it's like 10% of the population that has fertility issues. The best advice that I would give is to see us in the office for a consultation. We would do a sort of a workup, that ovarian reserve testing that I talked about, and that would really guide how successful IVF would be. But in general, I would say for a 42-year-old woman who's using IVF, in general is about 20 to 30%, where, less than 35, we see greater than 60% pregnancy rates. So not that it cannot be done. Yes, it can be done. We could do IVF with pre-implantation genetic testing. And when we do genetic testing on the embryo, it takes away the age factor. So you would go back to being about the same pregnancy rates, greater than 60% with a genetically normal embryo, even at 42. Next question.
Going off of that, what is the cost of freezing embryos? Just a rough estimate.
Is that a good question for Rose?
Yes. So depending the entire process, it will be $1,575, and then there's storage, which includes storage. But then after that, the annual storage fee at this time right now is $675.
Okay, what type of diet?
And again, and we would, sorry, about the egg freezing, because we also there are some insurance companies who are covering. And so when we do see a patient who's for egg freezing, obviously we're going to be verifying their insurance to see if it's covered.
Okay. What type of diet is best when undergoing fertility treatment?
I'll start off, or Tammy, please. You're more of an expert than I am.
So we call it our fertility friendly diet. And we say that it's really important that you eat things that are going to help nourish up, that are going to provide a high variety of foods that are giving you things like good fats and lots of leafy green vegetables, cruciferous vegetables. We also, lean meat and proteins can be important. Really, if you look at a Mediterranean diet, which is sort of, how they eat in Italy and so forth, where lots of wonderful natural products that go from farm to table can also be very, very important. Cutting back on things like sugar, artificial sweeteners, trans fats, like things like French fries, high fructose corn syrup. So there are things that sort of sneak into your diet that you may not even realize. And I think that one of the benefits of working with a nutritionist is to have more awareness about how you read labels and what you might be putting into your body. And just because you're eating a nice yogurt doesn't mean that all the ingredients are necessarily good for fertility and conception. So it's a very, very vast question with a lot of research and answers that can be provided. So we'll sort of leave it there, but we really do encourage folks to talk to your physician and potentially a registered dietitian to work on a diet, particularly if you have some weight to lose and even some weight to gain, as I mentioned earlier. That can be very important for conception.
What treatment plan do you recommend for someone who's had ectopic pregnancies?
All right. Well, it depends. I would do a thorough evaluation to look at the status of the tubes to see if they are blocked or not blocked following an ectopic pregnancy. Now, anybody who's had an ectopic pregnancy in the past are always at risk of having another ectopic pregnancy, no matter if it's a natural pregnancy or a treatment cycle. I personally recommend doing IVF because we do know that doing a frozen embryo transfer has a lower risk of having an ectopic pregnancy than a fresh transfer, because we're putting the embryo directly into the uterus. With that said, if one of the tubes is open by testing, like I spoke to about earlier in the presentation, that we're going to check the fallopian tubes, and if they are open, you're still able to do either natural if there is no fertility issues, or if there was an ectopic and also fertility issues, to do inseminations or stimulation, and then we monitor you very closely to see where the pregnancy is. To make sure that it's not an ectopic. So getting pregnant naturally, again, does not guarantee that you can have an ectopic. We just have to be very cautious and very careful following you to make sure that it's a normal pregnancy.
Okay, what are the risks of a 3-day transfer versus 5-day transfer? And how do you know if you use a fresh versus frozen sample?
That's a very loaded question. I'll start off with that we no longer do day 3 transfers. The reason for that is because our culture system has become so great that we can actually push the embryos all the way to day 5. And we do know that day 5 embryos, because we are selecting out or weeding out the embryos that wouldn't make it all the way to day 5, we have higher pregnancy rates with day 5 than day 3 embryos. Now, if there's a specific reason to do a day 3 transfer, yes. So embryo quality, number of embryos, number of fertilized eggs, many, many different factors, what we would recommend doing a day 3 versus a day 5. But ultimately, we were trying to push every single patient to do a day 5 transfer.
Okay. What, like you said earlier, what are the time frames between like trying and then starting to seek assisted alternatives?
Oh, great question. And I was actually going to answer that previously. What I recommend for any couple who's starting to conceive, who are trying to get pregnant, just go ahead and try. If you have irregular cycles, then you should definitely see your gynecologist or one of us, a fertility specialist, because if you're not having regular cycles, it means you're not having regular ovulation. It's going to be very difficult to get pregnant. So I wouldn't wait a whole year with irregular cycles to come see us. Other tips, start off with a prenatal vitamin. If you want to check for ovulation, you can. There's ovulation kits that you can pick up over the counter to time intercourse. If after 3 months of trying, you guys are unsuccessful, then the next step I would recommend to do is a semen analysis, and then to check to make sure that you are ovulating. And it also is age dependent. So if it's a 40-year-old woman and she's been trying for 2 months or 3 months, then you should definitely come see us. If you're a woman who's less than 34, you should try for 12 months before really seeing us. but we can definitely do a little bit of a workup because a semen analysis is very easy to do, and about 30% of couples have male factor infertility, so that's something we can actually cross out to see if that is one of the causes. And then the other cause would be to do a blood test to make sure that you are actually ovulating. If all those things look normal, I would say, continue to try 3 more months. If you're greater than 35, then after 6 months, definitely come see us.
Would the doctor we are working with at FCI be our doctor throughout the pregnancy, including birth?
No. So for the short answer is no. But the reason for that is because so we follow the pregnancy until 8 weeks of gestation, and then because we want to make sure that the pregnancy is growing correctly, we want to make sure that you're doing okay. We want to make sure that everything is normal before we send you off to see your OBGYN. So then after 8 weeks, the rest of the prenatal care is done by the OBGYN and the delivery.
This is an interesting question. Are you able to choose the gender?
So we're not able to choose the gender. We're able to test for the gender. So the only way to really know the gender prior to getting pregnant is by doing IVF with pre-implantation genetic testing, because the genetic testing will tell us if the embryo is normal and if the embryo is female or male. So the readout from the genetic testing is either 46XX normal female or 46XXY male. So then from those embryos, then we can choose which sex to transfer, but we cannot change the sex or we cannot influence the sex of the embryo.
When would genetic testing occur in the fertility process?
So there's 2 different genetic tests. One of them is for recessive genetic disorders, and that is done in the initial workup. The other genetic testing is on the embryo, and that's through pre-implantation genetic testing. And so anybody who goes through IVF, they have the option to do PGT.
Do you recommend genetic testing, and what age usually? For example, if you are over the age of 40, do you recommend genetic testing?
Yes, I highly recommend for anyone who's older than 40 to get genetic testing. The reason for that is there's studies that have shown that doing genetic testing is most effective in women who are older than 35. And that's because the proportion of normal to abnormal embryos start to rise. So starting around 35, there's going to be more abnormal than normal embryos. And so if you're less than 35, you're going to have more normal than abnormal embryos. So we don't see a benefit in doing genetic testing in someone who's young, but we definitely see the benefit in someone who is older because it helps us weed out the embryos that are genetically abnormal that would not lead to a pregnancy.
How many IUIs are usually completed before IVF? Also, if you decide to pause in between IUI cycles, will that impact your rate of success?
Again, this is dependent on age, diagnosis. Someone who's young, I've had patients who are 28 through 33, who would want to try to do it the natural way. And if everything else looks normal, I am not opposed to doing up to 6 cycles of IUI. I typically recommend doing 3 cycles and then moving to IVF. And the reason for that is because we do know from studies that after the first 3 IUI cycles are going to be the most successful. They have the highest pregnancy rates. After 3 cycles of IUI, pregnancy rates sort of plateau. And then after 6 cycles of IUI, we start to see pregnancy rates decline because it means that the treatment that we're doing is not overcoming the infertility. And so we have to be more aggressive.
Rose, do you want to add in?
And the last part, stopping, and no, there's no influence in taking a break unless there's an age factor and there's a very low reserve. Back to Rose.
Probably can't hear me. Can you hear me okay? Sorry, I'm having.
Yes.
Okay. So there are some insurance companies, depending on the woman's age, that will say, nope, you have to do 3 IUIs before you do IVF. And then there's also circumstances, again, the plans, or that they can go directly to an IVF without having a certain number of IUIs. So your insurance could also make a decision in that also, which way you have to go.
Thank you. Okay. So what do you think is the maternal age limit for patients when undergoing treatment at FCI?
There's a whole slew of treatment options that we have. And so in our practice, we do have a limit. The age limit for IVF for autologous, meaning stimulating your own eggs, is 45. And the reason for that is because after 45, using your own eggs, we really don't see many pregnancies. Pregnancy rates are somewhere less than 1%, even with IVF. And that's not with everybody. It also depends on your reserve. Like I said, the success of IVF depends on age, depends on your reserve, and then depends on your weight. So there's the 3 factors that impact success of IVF. So if you have a great reserve and you're 45 and you can do genetic testing and you can get a genetically normal embryo, that's still a viable choice. We technically don't do IVF after 46. It's also case dependent. If I have a patient who's 46 who has a good reserve and other different things, there's all of the practicing doctors, we get together and we discuss the case to see if it would be viable to do IVF or not, because we really want, you know, to give our patients the best treatment option possible. We also have third-party reproduction where we use donor eggs to get our patients pregnant. So we have women who are 50 years of age and also getting pregnant with donor eggs. So it really is dependent on the specific situation.
One more about PGT. Does insurance cover pre-implantation genetic testing?
As far as I understand, they do not, unless Rose has any other.
They do not cover genetic testing unless there's a history or a medical necessity there.
And they're not that lenient about what medical necessity is, because I have written letters, you know, for patients who've had problems getting pregnant, and I recommended PGT, and they still did not cover, even though I gave a rationale for that. It's insurance.
All right, we have 1 minute left. Any last minute questions for the panel? I think we're good. Okay.
Thank you, everybody, for joining us. Thank you, everybody from the panel, for being here to help and to educate our patients.
Thank you.
Thank you, everyone.
Bye-bye.
Thank you. Bye.